Welcome. Thank you so much for joining us today. My name is Amy San. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Today's program is part of our Climate Change and Health series, which is a special collaboration between the Blum Center, the MGH Center for the Environment and Health, and the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so that we hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and the guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. So next, I would like to introduce you all to our guest speaker. Joining us today, we have Dr. Barbara Belanger. Barbara is a perioperative nurse and chair of the Perioperative Sustainability Committee. She is also a member of the MGH Center for Environment and Health Outreach, where healthcare waste reduction initiatives across the organization are addressed. Barbara is currently promoting an initiative in Blue Wrap Recycling. Her work to promote a nurse-led initiative for recycling received a Clinical Excellence Award at the Association of Perioperative Registered Nurses Global Surgical Conference and Operating Room Manager Conference in 2019. Her doctorate in nursing practice work focused on informing healthcare policy for recycling from a national perspective, which was presented at the 2022 AORN Global Surgical Conference. She has presented her work to promote sustainability in a clinical setting at the MGH Institute of Health Professions and Cambridge Health Alliance. She joins us today to give a talk on healthcare sustainability initiatives to promote waste reduction. But before I turn it over to Barbara, Dr. Patrice Nicholas has a few words she'd like to share with you all.
Thank you, Amy. We're delighted to continue the Climate and Health series in partnership with the Maxwell and Eleanor Blum Family Center and Ms. Amy San. And we're thrilled at the MGH Institute of Health Professions with our Climate Change Center to partner with the MGH's Center for the Environment and Health. Thank you.
Thank you very much, Amy, for that introduction. And thank you, Dr. Patrice Nicholas. And my name is Barbara Belanger. And I am happy to be able to present the healthcare sustainability initiatives that have been developed and implemented in the perioperative area at Massachusetts General Hospital to address sustainability as well as climate change. And
give me 1 second. I need to pull up the slides.
Thank you so much. I appreciate that. Great. Could I have the next slide, Amy? Thank you so much. I would like to first recognize and thank these nurse leaders at Mass General Hospital who have supported my efforts to promote healthcare sustainability with waste reduction since 2017. Their visions are inspiring and their support is motivating. Debbie Burke is the Senior Vice President of Patient Care Services, the Chief Nursing Officer. Mary Ann D. Tomasi, the Executive Director, Nursing and Patient Care Services. Patrice Osgood, Associate Chief Nurse, Perioperative and Procedural Services. Michael Farrell, Director of Perioperative Services, and Sharon Bouyer-Ferrulo, Staff Specialist, Perioperative and Procedural Services. Next slide. I want to recognize with gratitude the privilege and honor to collaborate since January 2021 with the expert and dedicated Mass General Hospital Center for Environment and Health leadership team. Their work to address past, current, and future efforts at MGH in promoting healthcare sustainability that improves public health for the most vulnerable and to mitigate the impact of climate change locally, regionally, nationally, and globally is inspiring to me. I'd like to introduce Dr. Jonathan Slutzman, emergency medicine physician. He is also the director of the MGH Center for the Environment and Health. He's the medical director with MGH Environmental Sustainability. Dr. Winnie Armand, Primary Care Physician, Associate Director of the MGH Center for Environment and Health, and Patrice Nicholas, Dr. Patrice Nicholas, Professor at MGH Institute for Health Professions. She is also the Director and Founder of the MGH Institute for Health Professions Center for Climate Change, Climate Justice, and Health. She is the Co-Director for the Policy and Advocacy on MGH Center for Environment and Health. Patrice Nicholas is an exemplary mentor for me who has shared her experiential knowledge as she encouraged and guided my efforts to promote healthcare sustainability in the clinical setting. Thank you, Patrice. Next slide. This is the guideline for this presentation. I will, after showing why we should care, I will present data that supports efforts to reduce waste and provide an algorithm that may be used in your facility to develop programs. I want to show why reducing waste matters to me, my colleagues, and my peers. Next slide. These pictures point out why we should care. The picture on the left comes from an audit at MGH that was headed by Dr. Jonathan Slutzman, and it shows all of the trash that was collected in one day on one unit. It was quite a bit. The next picture is a waste facility management in Massachusetts, where that trash in the first picture may end up. Most of that trash will be sent to incineration and landfill. The two pictures on the right demonstrate why we should really care. The global healthcare sector, if it were a country, would be the 5th largest emitter on the planet. And the one below focuses on the US healthcare sector, as if it was a country, it would be the 13th in the world for greenhouse gas emissions. This is quite concerning. Next slide. This graph comes from a journal from researchers in Great Britain, and they demonstrate the types and quality of waste that comes from an operating room in their country. As you can see on the left, recycling is very low, and on the right, a lot of the clinical waste, medicine waste, medical waste, and infectious waste are high. This is probably very replicable in other countries as well. Next graph, next slide. I want to just first of all explain what healthcare waste is. That first graph did show the quality and type in the operating room, but it's any waste that's generated from patient care, treatment, research, or operations within healthcare facilities or clinics. Medical waste is any waste that may be contaminated by blood, body fluids, or other infectious material, and is often referred to as regulated medical waste. That has its own guidelines and regulations for disposal within each state. This slide shows the sources of waste on greenhouse gas emissions in the healthcare industry. This is the first part of how I'm going to try to connect healthcare waste with climate change. The industry has divided a lot of the waste into 3 scopes. And the first 2 are related to energy in terms of transportation and heat sources within the organization. And as you can see, that totals about 18%. The bulk of the waste, in 82%, comes from a conglomerate of waste types that come along anywhere along the line of healthcare materials and products that are produced, used, and then disposed of. As you can see, waste is in there too. It is part of the big picture. And we really need to take our knowledge and make changes here to help reach net zero waste. Next slide. EPA, the Environmental Protection Agency, has these descriptions here to describe what the scopes are. As I said to you, the first and second are direct, and they're related to fuel, fossil fuels, and electricity. And I know that many of my colleagues, my physician colleagues and leadership colleagues at Mass General Hospital have been very influential in creating change to divert away from use of fossil fuels for supporting our heat and our electricity. It's one of the things that we're doing here, and I always like to really mention this, is most of the electricity from MGH does come from wind farms in New Hampshire. Scope 3, as you can tell, waste is right in the middle of it, and it goes through, it has an awful lot of stakeholders that have a part in the production, manufacturing, and then use and disposal of all of that. And this knowledge highlights our need to increase education for awareness and engagement in reaching our net zero waste. And making a difference. Next slide. These statistics describe how much waste is generated in healthcare globally and nationally. These statistics have not really changed too much since I first started in 2017, except to increase. We do have over 5 million tons of waste generated by hospitals annually. That's globally. 2/3 of that is regulated medical waste, the type that is bloody or body fluids or infectious nature infected. The next few statistics have guided all of our initiatives that we have put in place into the operating room. 30% of a hospital's total waste is produced by the operating room. This is quite a bit. We also are a generator of a huge revenue as well. And there's an awful lot of work that's being done in operating rooms that need all of that, all those products that end up as waste. 19% of that waste is blue wrap, and I'll go over that in a later slide. Of concern to most of us in healthcare, 20 to 25% of our waste is plastic-based. And we are really trying to focus on that, but prevention of infection and being effective in the care that we are delivering is a big part of why those numbers are there. Coming up is 10 to 15% of food waste is generated by hospitals out of their waste. And as you can see, we do have a 4.6% increase of total gas emissions, but the most concerning statement is the last one, is our emissions have increased by 6% in 8 years, from 2010 to 2018. That is where we really need to focus on. Next slide. As I indicated in the previous slide, greenhouse gas emissions are increased by human and natural causes with the focus on healthcare one as our focus. The impact of waste causes an increase in greenhouse gas emissions, which lead to increased global temperatures. There's a description of some of the greenhouse gases that we are dealing with. Carbon dioxide is the largest amount of greenhouse gas that we actually deal with. Nitrous oxide stays in the atmosphere for a very long time. Methane is from landfill, and then the others are part of the disposal process. The two diagrams on the right, they are still effective and used in education today. They do show the natural greenhouse gas effect, but also the effect of it from humans. As you can see in the left diagram with the blue around the Earth, it's showing how the sunlight comes through the atmosphere, but it's also generated back out, so that much of the heat that comes into the Earth is actually sent back out and creates a balance of some degree. The one on the right, as you can see around the circle around the atmosphere, is now in red and orange, and this indicates the impact that greenhouse gas emissions and particulate matter have created in redirecting that greenhouse gas emissions back to the Earth, increasing the heat. And the diagram on the right, this shows a cause and effect of the greenhouse gases and global temperatures. As you can see, it's been monitored since 1880, and the upward trend started post-World War II. And it's showing that burning waste and fossil fuels do reduce carbon dioxide. Remember, I told you that was the highest amount of greenhouse gases percentage. It goes into the atmosphere, but also goes into the oceans as well. It traps excess heat in the atmosphere, and it causes acidification and mercury contamination in our oceans. You've seen those I don't know if you know about the plastic islands all around the world in the oceans. Those are very concerning too, because what impact is that creating on our oceans, on the fish, and ultimately our health? Next slide. Amy, I don't know if you can actually click this on. That arrow. This is just a small visual from NASA. It shows you how the greenhouse gas is reflected back in, and then when it turns red with all of the greenhouse gas emissions, it's showing how the heat is trapped and doesn't get back into outer space as easily as it used to. And thus this is creating the warming that we are actually experiencing right now. Next slide. All right, I want to start with the graph in the middle. This is a graph from NASA, and it shows the effect of solar radiation on our climate and the Earth's temperature. The yellow line is the increase or decrease the amount of sunlight that gets to the Earth. It relates to the amount of heat that's absorbed by the Earth's surfaces. And then and the red line shows the effect of this decrease or increase of sunlight on the Earth's temperature, as cold or warm. And as you can see with the sunlight, with a decrease in amount of sunlight getting back out, it's impacting a rise in the temperature. It's also the cause of an awful lot of climate change issues that we are very much aware of today. I would like to start with the pictures up in the upper left. These came from a colleague of mine who was up in the Canadian Arctic. She's approved me to use her pictures, but it was really disheartening to hear what's going on. The picture on the left was taken in November. That should be solid ice. That is the way that polar bears can travel to get access to food and survive and keep on going as a species. The picture on the right is a polar bear that is starving, and there's not much that we can do to change that at this point. Right now, we have a way to actually help prevent it from getting worse, or to help prevent it to get better. That's for other experts to take care of that. The pictures that I've included in here demonstrate the impact of greenhouse gas emissions causing a lot of the heat and the climate changes that we're experiencing right now. The fires out in the Pacific Northwest and California are horrifying to watch. And it's a lot of heat that's causing an awful lot of deaths and destruction. The picture in the bottom is of flooding. We have the recent flooding in Florida to demonstrate the impact of deaths that come from flooding. Over 130 in Florida is very, very sad and just awful to hear. The tornadoes and hurricanes that are coming about have been increasing in number and severity, and they're causing, all of these events are causing a lot of destruction and impacting the lives and ability for people to live in certain areas, and costing an awful lot of money in restructuring and rebuilding to, again, rehabilitate some of these areas. Next slide. This comes from an article from the MGH Institute for Health Professions, and it's creating a connection between environmental degradation and harm to humans and our Earth. I did take an article from Matthew Myers in 2021 showing the increase in degradation to the environment as a cause from mining for coal or lithium. But also, I added the lithium. He only added the mining for coal, and also the drilling for oil, and how that destroys the portions of the landscape and where this work is being done. And then also burning of fossil fuel, polluting the air and the sea, burning waste and holding waste in landfills, leading to pollution. The MGH has recognized that since the 60s, we've been addressing climate change and the impact of greenhouse gas emissions on global warming. Next slide. Climate change does have an impact on human health. This is a slide that comes from the CDC, and it's very familiar for many of us in healthcare. It's showing how all of the different types of changes in climate change and the impact on human health. And I know you've heard a few of these, the extreme heat causing death and cardiovascular failure, increasing strokes, and environmental degradation, migration, conflict, mental health impacts, which is a real concern for many of us, and then changes in the vector-borne diseases. Next. This is where I want to create the connection of healthcare waste and waste in general and public health. Most of the impact comes from disposal of waste in incineration and landfill facilities. Many of these are located in lower socioeconomic areas, increasing the vulnerability to the communities surrounding those areas because they stay there. They may not be aware of what's going on. They may not be aware of the impact on their health or how to protect or have any resources to protect themselves. Research has shown there's a contamination of food and exposure to pollutants near incinerators. They also have shown an increase in the incidence of illness and disease, respiratory diseases, pediatric asthma, cardiac diseases in adults, strokes, cancer, birth defects, endocrine and autoimmune diseases. It's very concerning, and it's one that I will point out that these facilities are aware of. They're listening to the public health findings. They are looking to create technological changes in the process that they're doing. But we still have to always be aware of the impact that we have on another person's human life and health. Next slide. This is a connection that I wanted to make with climate justice, healthcare waste and climate justice. This picture is in the United States. It was taken in 2019, and it comes from California. And all of that waste is just, some of it's left by humans, but a lot of it comes up from the oceans with the tides. And it's very concerning in the fact that it's still there. It's there. And the Mass General Institute for Health Professions has identified that the people who suffer the most are those who are most vulnerable to begin with, living in areas where there's this waste just accumulates and impacts their health. And we have a right and a moral obligation to do what we can to help them out, to help prevent it and reduce the amount of waste ending up in this beach like this. Next slide. This slide identifies my opinion. Every person's action to help helps. It doesn't matter. We all have a part in how we can make this work. The CDC has created this diagram to show how healthcare can take action. And as you can see, there are many little different processes and opportunities within the little clouds, the green clouds. The graph up on the top left comes from an article by Matthew Meyer talking about how physicians have recognized the need to help out in decreasing climate change, because we're here to help promote health, and they're all stepping up. They are stepping up. As I said earlier, a lot of my physician colleagues have stepped up to help decrease the amount of waste anesthesia gases being exposed into the public, changing their practices to make that happen, looking for alternate ways to have energy produced so that it does not have a huge impact on the community surrounding the hospital, and doing everything they can to support efforts in reducing waste and greenhouse gas emissions. And the one on the left is the one I'm proud of. This is what nurses and the OR are doing to help take their part in reducing waste and greenhouse gas emissions, ultimately mitigating the impact of climate change and promoting health for the public, because that is our focus. Next slide. This graph comes from Practice Green Health. I have worked with Practice Green Health for quite a while, and they've been very influential in a lot of my education programs. This was one of their guides in terms of helping to reduce healthcare waste. As you can see, recycling is at the bottom of it. This came after the recycling market faced a major change in 2018, and then post-COVID pandemic, and a lot of things changed. And we are looking at things not in terms of what is lost, but in terms of how do we change it and make it better and reflect the current environment, the current needs, and the current resources. How can we do it? And Practice Green Health has a lot of tools, and their first one is reevaluate. And that's what Mass General has been doing, an awful lot of these steps right along. Reevaluate, what do we know? What do we need? And what can we take away? How can we reduce what we do not need, and reduce the amount of energy that's needed for processing? And how can we reuse without adding to the problem? And other areas are reprocessing. We've been doing an awful lot of that in the operating room. Repurpose. And then, as you see, recycling's at the bottom. It's not absent, it's just changed. It's a little bit different. Next slide. And Healthcare Without Harm, they have been influential in promoting healthcare sustainability for a long time. And they are a guide for a lot of the physician colleagues that I have. And they are a resource that I have used in terms of my programs and development and education. Zero waste is a goal, and that's in Massachusetts as well. and it's been a huge goal in healthcare. Healthcare is a huge industry, and we are working to turn that boat around to make it a better process that reflects what we need to do to decrease climate change. And a lot of these things will come, and their hierarchy in their side down triangle is basically the same as practice greenhouse. It's just reevaluating, reducing, reusing, and then recycling. And disposing is at the very bottom. Next slide. I will say one thing before I move on to this one. This is where I'm going to be starting with all of the initiatives that we have put in place, or that we have in place and are putting in place in the operating room. A lot of the changes that are in place really do require buy-in, not only from leadership support, but from stakeholders all along. And this includes all of the staff at the bottom, not the bottom, but at the point of care, and who deal with the trash, not only bagging it, but transporting it and taking it wherever it needs to go. We all need to really have a voice and speak up in terms of what we can do to make things change, and actually work with processes that are being developed to try to mitigate the impact of climate change. And always keep in mind patient health and healing is part of our process. These are initiatives that our organization has been doing for a very long time. Paper recycling has been around for a long time, and it's effective, and it's been going on through COVID. Same thing with cardboard. And the reason I can say this is because all of these processes do not have anything to do with clinical care or patient care. This waste is collected before it even enters into the clinical areas, except for some of the confidential paper. That is another. We need to pay attention to HIPAA, so all of the HIPAA paper and confidential is recycled as well. Cardboard is a big industry. Batteries, there is a way to recycle batteries, and I try to encourage everyone to remember to do that. Plastic, glass, and metal, that is still collected for recycling by vendors, but in non-clinical areas only, such as the staff lounges. And education is always necessary there too, in terms of promoting effectiveness in what we actually put into these bins to reduce contamination. Because once a bin is contaminated with food waste or plastic or anything that is not recyclable, it will be discarded as waste to incinerators or landfill. And that's our goal not to have happen. The food waste to energy program that is used at Mass General, that is in the cafeteria. It's been around since 2014, and it is very effective. And it was an inspiration for me in one of my initiatives. Next slide. These are nurse-led initiatives that I'm going to be talking about now, and I'm very proud of the nurses at the clinical site and the scrub technicians who have been and the ORAs who are all very influential in making this process work. Single-use reprocessing takes items, single-use only items, and reprocesses them to extend their life cycle longer than just one use. The single-use only surgical items that I have on the top, that is a process we have with one of our vendors to take some of the surgical items that we use, staplers and such items on the surgical field, and they reprocess them. They collect them, we collect them, they take them, and then they reprocess them in a way that maintains infection control and effectiveness. What we did as nurses in the perioperative area is improved our processes for reprocessing compression sleeves. If you see the picture on the right with the box and then the plastic in back and then the boots on the bottom, those are all reprocessed and reused. And as I said, one of the biggest things that we really do is maintain infection control throughout all of our processes in use. Oximeter devices, pulse oximeters, when you go into the hospital and there's a little probe that they put on your finger and it is disposable, they actually are not disposable. They take them, they collect them in the units, and they are collected by the Environmental Service Department and recycled, reprocessed, excuse me. Tourniquet sleeves, We work with our vendor. The tourniquet sleeves are that picture of 4 tourniquets. That is, there's a process in place to collect those once they are used and reprocess them through the vendor. And we get them back and we're able to reuse them. And this increases the life cycle, and it's been effective. And I did an audit which showed that nurses are understanding of this process and are very engaged in it. Next slide. This is the most exciting news that I've had for a long time. Blue wrap recycling. As I said to you, blue wrap recycling was 19% of a total OR's 30% waste that it contributes. And when I saw those statistics back in 2019, I brought up the idea at the committee that we established for developing a recycling program. And we initiated this planning in 2019, as I said, and we developed a process within the hospital for collection of the blue wrap, for transport of the blue wrap to the hospital, and then processing of it with a baler, and then collection by our vendor, our waste management vendor. And I had developed a program for education that I was going to be implementing in March 2020. And as we all know, COVID came, and COVID put a halt to all recycling coming from healthcare. It was totally understandable. The dilemma of COVID on the lives and health of so many people has been just traumatizing and horrifying to watch. As vaccines came into effect and started to create some positive change in the health related to COVID, and as our world started to reopen, I brought up the idea again, since everything was already in place, I brought up the idea again to recycle blue wrap in June 2021. We talked about it, we discussed it, we developed a new program and a new process for how we were going to implement this recycling process. And we were able to put a pilot study in place in October 2021. And it was on 1 unit of the OR, and it was very successful. It was huge, and the nurses and the scrub technicians and the ORAs were very supportive of this process. And as you can see, this is one of the bins that I took a picture of, which is collecting the blue wrap. I will take a mention that the blue wrap is a plastic-based item that is not disposable. It persists in the environment, it's horrible, the impact this will have on the environment. And if you can tell, a lot of plastic has a lot of toxins in it that when they're incinerated, they release those toxins into the air. So this is a huge process, and we expanded it to include 2 other units in our OR, and now we are expanding it further this fall. We're in the process of doing that right now. And one of the things, we have been doing some measurement of this with our vendor and with the environmental service, and the outcomes since we started this pilot study, since December, since collecting it, we have collected 6 bales of blue wrap that we've been able to be collected by our vendor for recycling or reprocessing. It's a great opportunity, and I'm so happy for all of this. Next slide. This is another initiative that we actually started. The statistics at the beginning of this, I remember I talked to you about the amount of waste coming from hospitals was 10 to 15%. And then Healthcare Without Harm shows that if you reduce food loss by just 15%, 25 million people would be benefit from that. That'll be a co-benefit of our efforts to reduce the waste. And the ways that they showed of reducing this and controlling costs and impacting climate change is composting and anaerobic digestion for energy. And I will go over that in just a minute. The food to energy program that we have in Mass General Hospital, all the food is collected in the cafeteria, and it is picked up by our vendor and brought to a facility where it is processed into anaerobic digestion. And this creates electricity energy for the community. And the outcomes that we have from from our Environmental Service Director, Latoya Brewster, and also from the Nutrition and Food Director, Joan Shea, shows that 1 year of collection of food waste supplied energy for 50 homes for that whole year. And that is very motivating to keep on moving for this. I was able to get this program into the operating room, and we started it last November. And with 2 pilot studies going on, it's a lot of education and a lot to implement. But we are working on this, and we are still creating education programs to increase awareness that it's there, and what actually can be collected for by this program. Next slide. This is a hierarchy similar to the one for how to recycle waste. And this comes from the Environmental Protection Agency. And as you can see, landfill and incineration, again, are on the very bottom, disposing of that way. Composting is just above landfill. And that's because of the methane that's released from it and the impact of that on greenhouse gas emissions. So the one just above that is industrial uses, and that's where the anaerobic digestion comes in. And it just creates a huge benefit in our community. But similar to the other 2 hierarchies in terms of how to control waste is reduce, reuse, and repurpose, I guess is another way to feed hungry people, because there is a way for donating extra food to the bank from cafeterias, from bakeries, from restaurants, that follows guidelines for safety and infection control within each state. Next. We don't just stop at what we have collected there. There's a long way to go. And the center of all this is a Plan, Do, Study, Act algorithm that we follow in nursing to evaluate problems, to create resolutions that work, and demonstrate outcomes measurements that are positive. And this is the basis of everything that we do, is creating evidence to support our actions and to support what we are actually teaching. And I will say one thing: teamwork from an interdisciplinary, interdepartmental, and a leadership and staff position is very effective in creating change. The picture on the right, these are around this are areas that I really would like to help create change in the future. The picture on the right with the table holding all of those plastic bottles came from one surgery, and it was just horrifying to put them in the trash can when we know that they can be recycled. They're clean. They never touched any patient. Contact in any way, and but there's no way to clean them and then reprocess them, and there's no way to recycle them at this point. But that's my goal. That's a goal for most of us in the OR. We really would like to see, as much as we can, how we can capture this easy way of minimizing waste going to landfill or incineration. There is a program out there for recycling syringes. It's unclear right now where that is, how that is, in collaboration, not only with infection control, but also the DPH in different states. But that's an area that I'd like to really investigate. And I know other areas in the hospital are doing what they can, no matter how little it is, such as recycling pipettes from the research labs, and that. The other focus that we have for the future is a Center for Environment and Health initiative, and that is to reduce contamination of regulated medical waste at the user site, but also to reduce contamination of recyclables. Because if you reduce contamination of recyclables, then everything that's collected in that green bin will be picked up and reprocessed as recycled material. And one thing with the recycling is knowing where it actually ends up. The recycling for the Blue Wrap that I forgot to mention, which is a really important aspect of it, is that Blue Wrap, the recycling of Blue Wrap creates products for healthcare products, such as bins and basins. And my inspiration for that came from a colleague up in University of Vermont Medical Center Monique Citro, who has been involved in blue wrap recycling for quite a while. And she has a YouTube video showing how the recycling process actually works. And it was just really amazing to watch. And Practice Green Health, Julie Moyle, she has been very helpful in education and reaching out and networking with others to create programs and processes. Now, the one thing that is really a passion of mine right now is the circular economy, is how to be nurses stepping up as partners in creating a circular economy. This starts where, as I told you, with scope 3 waste, it includes the production of the products, but also the transport and then the use of it, and then the waste of it. And if we can create a more of a circular economy where there's less waste going out and more going back into the manufacturing of it, that will be the best way to go. And one of the biggest goals that we have for this in our facility is that we would like to decrease the amount of packaging that all of our products are transported to our unit, our hospital for use. And that's also another work in progress. Next. This is I wanted to show, this is the algorithm I created in terms of how we started our sustainability work in the perioperative area. Like any successful program, it started with an idea, and that idea was an idea to improve recycling that I discussed with my director at that time. And we agreed that it was a great opportunity, and we wanted to create a committee to do that with a sustainability leader as sustainability leadership. And that just started the whole program. But there were key factors that were really relevant to our success. And that was that who we included in on this program was everyone. We tried not to make it a silo. We tried to work with the rest of the hospital, the rest of the hospital. It was interdisciplinary, it was interdepartmental, and it involved the staff at the front of care. It included materials management, it included purchasing, infection control, environmental services. There was a lot of individuals and departments that needed to be included in our program development. It was evidence-based. Everything we did was based on the research that was available at that time, and we kept updating the research. As I said, most of the research showed that there was just an increase, particularly after COVID. It included an awful lot of engagement by stakeholders all along the process of the manufacturing and use and distribution and disposal of all of the products. It also included participating and working with our vendors and waste management facilities. We started it off with a charter to show our mission in terms of what we wanted to achieve and what guided us, what philosophy guided our work. And one of the things we wanted to do was capture how recycling was at the point of care at the site. And we did this through a survey, and we used it for data collection and analysis in terms of evaluating what the barriers were, how we could overcome those barriers, would the solutions be effective, we started a pilot studies, and then we collected the data from that and looked at it and created changes based on all of the measurements that we actually did collect. Education was a huge factor of this. We had staff meetings with presentation of the whole process, and our staff meetings included groups. And I always feel that it's not just one person that creates a change and one person is responsible for it, but it's everyone working together as a team with that focus in mind. And with that approach, I used resources from Practice Green Health, Healthcare Without Harm, the CDC, Department of Health, any of the NASA, any of the state and federal agencies that were trying to promote healthcare sustainability. And we used many of the tools that they had available for developing education programs and the resources and networking as well. The thing that the perspective, I should say, that guided all of our work to create positive change had to include a lot of other issues that maybe nobody likes to think about, because when you're doing the right thing, you have to be careful of an awful lot of other perspectives that impact that change, and that's the cost benefit analysis. That's huge, especially in a world where finances and cost are a burden, and we need to really be careful we're not adding to it as we're trying to improve health and health processes. We need to make sure that we are promoting quality and safety. We need to ensure that infection control is addressed, that there's no potential for infection from what we're trying to put in place. And we need to make sure that it is effective, that the life cycle that we are trying to create is effective at the point of care by the providers and the clinicians. And I will say that this diagram up on the left really said it all. It started with an idea, and we were persistent and patient as we worked hard to create a process for performance improvement. And I will say I remained focused and passionate about this whole process as we were pushing efforts forward to keep it in the limelight, keep it going. And even as things seemed to be falling apart, looking beyond that in terms of just because they're falling apart, how can we restructure and make it better? And then we are patient care servers, and our whole focus is to promote patient care, health, and healing. And this has been a really great opportunity to be part of this process with climate change, climate justice, and health. And I am very grateful for everything we're able to do. And I am very grateful to my colleagues and peers at the point of care for all of their support in helping us achieve our goals. The next few slides are just the references that I used to create this program. Next slide. Next two slides there from the CDC, the Commonwealth Fund, EPA. Next slide. Healthcare Plastics Recycling Council, Healthcare Without Harm. Many of the articles that were written to improve technology and demonstrate how climate change, climate justice, and health can be achieved. And then the physicians that are helping out. Next slide. And NASA, Practice Green Health, the carbon footprint in the UK. The UK is very influential in promoting climate change. And Dr. Slutzman's article, and the impacts of waste incineration in Australia in addressing environmental justice. Thank you very much for the opportunity to present this information, and I look forward to any questions.
Thank you so much, Barbara. We
Thank
are
you.
now at the end of the session, so if you have any questions for Barbara, feel free to enter them in the chat. So Barbara, we have a question. What do you think will be the future of sustainability initiatives for healthcare organizations? For instance, this person knows that Boston Medical Center has a rooftop garden, which supplies some of the nutrition for patients, families, and staff. Additionally, what do you think about plant-based foods? Also, do you think plant-based foods may become more common in food services, since we know that cattle livestock is a major source of greenhouse gases?
Yes, I do. I'm very impressed by what BMC has done with their garden on the top of the hospital. It's very it's inspiring, and I do believe in Mass General Hospital we have switched over to include plant-based foods in our diet, because there's a huge trend in awareness of the impact that beef and the beef are exerting on greenhouse gases, but also the impact that we're creating on fish in the oceans. And I believe that plant-based diet is here to stay. I think it will be part of some people's diets, but it may be a complete focus in many individuals' lifestyle. So yeah, I do believe in that, and I do partake in it too. And I'm hoping to see a whole lot more in the future.
Thank you. Since these initiatives have been implemented, have there been any data to show any improvements or number of wastes in reduction?
Yes, as I showed, the waste and reduction comes from the environmental service, and we've seen the amount of blue wrap, 6 bales of blue wrap that are now that have been taken from out of waste and transported for recycling. And that data comes from the environmental service department. And that's where we get most of our data in terms of their weighing it and comparing how much that is taking away from where the waste that's actually going for trash or incineration. The thing to remember too is all that amount that's being taken away from trash is not getting recycled, not getting incinerated, and exposing more communities to toxins as well as increased greenhouse gas emissions. Because, as I said, 19% of that was blue wrap, and that is a solid plastic. It's great. I mean, it helps to prevent contamination of instruments, but the impact of it in disposal is really harmful to the health. So everything we can do to help promote that is on our agenda.
Thank you. As we all know, the COVID pandemic has changed us in many ways, including single-use masks, gloves, hand sanitizer bottles, even single-use cups and utensils. Have there been any studies or data on this, and what can we do?
I mean, for the data for the single-use only items, as I said, the plastic coming from healthcare is 20 to 25%. I think the amount of gloves and masks that we're seeing not only in our waste cans but also on the grounds outside is really alarming to an awful lot of us in the community. And I think that this will take, my hope is that this will take us into a whole different way, not only of increasing education of the harm that this is causing, but also trying to look for solutions that will help us decrease the use of plastics. I know in our operating room, one of the things that we have coming through now in our packaging is we used to have styrofoam trays holding some of our supplies. Now they are coming in with it's a compostable and biodegradable trays. And that's huge. That's not going to create any, even though it may be sent right now as trash, it's not going to add to the toxins in the coming from incinerators. And this has been a focus of the director where I work in terms of promoting this composting. But it's still a new and emerging technology. And as I said, as soon as we, I think what happened with China closing the borders for taking in a lot of recyclable waste and showing the weak infrastructure that was in place in the world, and also COVID showing the infectious nature that we need to be aware of, I think we're looking at this as an opportunity to create change that will be more beneficial to public health, but also to the planet, and decreasing the amount of carbon dioxide that's going into the air, but also decreasing the waste that's being thrown all over the place. I mean, I think this is a great opportunity that we have. And I do believe all of the education that we can put into place to increase awareness of it is the first step to creating that change. And I'm pretty grateful for that opportunity to be able to help.
To help increase awareness and education on this, where can one go to learn more about this topic?
Well, the first place that I'll recommend you to go is the MGH Center for Environment and Health. They have a lot of information there. They have a lot of connections there for this is a great resource within our institution. It shows all the initiatives that we're involved in. And it's not just within the OR, it's throughout the whole institution, and it will show in breadth the whole facets, all of the facets of work that's being done to mitigate the impact of healthcare on climate change. And the other one, as Dr. Nicholas's site, Mass General Hospital Institute for Health Professions, the climate change, climate justice, and health. We have a lot of resource and educational articles that are very inspiring and motivating to help engage the public as well as the clinicians in our efforts.
Thank you. Can you or Dr. Nicholas share those resources in the chat for anyone who may be interested?
I definitely can share them, Amy. I don't think I can put my fingers on them right now.
Okay.
But we have a whole list that I'm happy to circulate.
Great. Feel
Can
free
I send them to you?
Yes, absolutely. If anyone's
Great.
interested in those resources, feel free to send an email to the Blum Center at pflc@partners.org, and I'll enter that in the chat. If you're interested, we can share that with you. So let's see if we have any more questions. Before we end today's session, do you have any final thoughts you'd like to share?
You know, I think that Boston is a great area for creating a lot of these technological changes and connections and networking for anyone to actually reach out. There's also a lot of associations such as the Crew, and they are very influential in urban protection with trees and heat related climate change issues. And there's a lot of resources that are available to help anyone living in Boston to help mitigate and help protect themselves from these the impact of climate change. You know, and as I said, waste is just a facet that adds to it. There's so many other issues, and we have all that information available right here in Boston. It's a great town.
Thank you. Dr. Nicholas, do you have anything you'd like to share?
I'd like to thank you, Amy, for welcoming us for the Climate and Health series. And to the audience, we thank you. And we look forward to joining you again in November and December.
Thank you so much. As I had mentioned, today's session is being recorded. So if you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.
Thank you.